Thank you, Dr. Gust Bardy, for joining us today. Dr. Bardy is Professor of Medicine and retired from the University of Washington. And thank you for agreeing to speak with us to help the millions of arrhythmia patients around the world. Welcome.
Thank you. Pleasure to be here.
Now, we have a lot of questions about the difference between an ICD and an SICD, subcutaneous ICD. Could you explain to our patients the difference, please, and who should qualify for an SICD versus an ICD?
Sure. So an ICD is an implantable cardioverter defibrillator. An SICD is a subcutaneous implantable cardioverter defibrillator. To the lay person, they both go in the body, they sound the same. The difference with the SICD is there are no electrodes that go into the heart, okay? People need electrodes into the heart when they have slow heart rates and they need pacing function, or they are candidates for a term called anti-tachycardia pacing, which is a complex domain that has to do with trying to stimulate the heart out of an abnormal rhythm that leads to cardiac arrest, but is not a cardiac arrest per se. Both devices, the ones with leads and the one that's just under the skin, the SICD, they do the basic role of an ICD, and that is they're there to shock the patient out of a very nasty problem that will kill them, called ventricular fibrillation. So when I've inserted these devices, my typical comment to the patient is, I hope this is a complete waste of your time. Or may it never work. May it never be used on you. It's just there as your personal paramedic. It's there. And years may go by with nothing happening. And then on year 6 or year 7, out of nowhere, you develop this problem, ventricular fibrillation. The device has a way of picking it up, and it charges itself up to deliver an electrical jolt to your heart, which you will not like. But the alternative is death. So that's what they're for. And they're very valuable for people at risk of that problem. Certainly, if you're not at risk, you shouldn't get one. So that's the difference between the two is electrodes in the heart, no electrodes in the heart. Many people qualify for the subcutaneous only device if they don't have slow heart rates or they don't have this problem called monomorphic ventricular tachycardia. Then they tend to do the same. They tend to do as well, and recent data has demonstrated that, that they tend to prolong life as well. They have the same level of appropriate interventions. There are inappropriate interventions. Sometimes they get a bit trigger happy, let's say, and they're overly aggressive, which is okay. It's not fun to be shocked, but it's okay that it is suspicious of an abnormal rhythm and overacts, rather than being, let's say, listless or lackadaisical about your rhythm. You want it to intervene aggressively. So you should expect a certain degree of what we call false positive interactions. That's okay. Both have about the same degree of false positives, the same degree of complications, perhaps a little bit more complications on the transvenous electrodes because it's a more complicated system. Just like a more complicated car, it tends to have more checkups needed. So, but both critically, the critical issue is both save lives and they do so in the population of patients with, for example, heart failure, or who have had a large myocardial infarction, or who have had a cardiac arrest before and have survived.
And that's exactly what we tell patients when they have a shock. Although it's not pleasant, they should be grateful because it proves the device has saved their life.
Yeah, yes. It's a very important thing for people to remember. Most people, the false positive rates where devices intervene, roughly 5 to 10% in that domain, depending upon the device.
Mm-hmm.
That's okay. In exchange for a 99% protection against death from cardiac arrest. That's a terrific deal. So I'm quite, I don't have one yet, but if I had the indication for one, I wouldn't hesitate getting one, and I would get either depending upon what else is going on in my heart.
Yeah, and often once patients have that explained to them, especially if another member of the family has previously died from a sudden cardiac arrest, they actually realise how lucky they are that they've received this treatment. But it's all about patient education and understanding, and that's why these videos that we're making are so important. I think if patients watch this and hear you explain, they will be even more appreciative of this little device that they have in their body that's actually there to save their life. Thank you, Dr. Bardy. Thank you for your time, and thank you for all that you do for patients.
Well, thank you for all that you do, Trudy. It's a beautiful piece of work that you've done there, and may you continue to do it with or without the pandemic.
Thank you so much. Thank you.
Bye-bye.